Good morning. My name is Claudia Fegan. I recently retired as Chief Medical Officer for Cook County Health, a large public health system in Chicago. I'm also the longtime National Coordinator of Physicians for our National Health Program. We're an organization of more than 25,000 doctors who are fighting for improved Medicare for all. We're hosting today's shadow hearing because Dr. Mehmet Oz has a very different vision for American healthcare. Instead of seeking to improve Medicare, Dr. Oz and the Trump administration are trying to destroy it. At a time when Americans are furious at corporations like United Healthcare, President Trump is resisting calls to crack down on their abusive practices. Instead, he's planning to reward these firms with billions of taxpayer dollars. The Trump administration is also putting huge cuts to Medicaid, and people across the country are bracing for another round of attacks on reproductive health care. During his Senate confirmation hearing, RFK Jr. said, quote, "I serve at the pleasure of the president. I'm going to implement his policies. We have no reason to expect any different from Dr. Oz." Make no mistake, Dr. Oz is a good salesman. He spent years promoting so-called Medicare Advantage plans, and he's likely to make a slick presentation about why he should lead the Centers for Medicare and Medicaid Services during today's official hearing in the Senate Finance Committee. Don't you believe it? Despite Dr. Oz's promises, corporate health insurers have shown time and again that they are not to be trusted. Firms like Cigna, Aetna, and Blue Cross Blue Shield have been delaying and denying care for seniors for over 20 years. As a result, their profits have, excuse me, as a result, their profits have skyrocketed and have soared to astronomical levels. Physicians understand this, and you'll hear several doctors from around the country today talk about their frustrations with health insurance corporations. Dr. Oz may be a big fan of United Healthcare, but the vast majority of physicians cannot stand it when insurance company middlemen interfere with their care for their patients' needs. In addition to hearing from physicians, we'll also hear from nurses, allied health professionals, students, seniors, and activists who stand firmly opposed to corporate health care. Plus, we'll share ways for you to join the fight, because we stand together. When we stand together, we win. To kick off our shadow hearing, we'll hear from Alex Lawson, who's joining us live from outside the hearing room in the U.S. Senate. Alex is the executive director of Social Security Works, which has been an invaluable ally in the fight to protect, improve, and expand Medicare. Alex, what do you expect to hear from Dr. Oz in the hearing today?
And we're outside the hearing room where the Republicans are going to be putting in place their point man for the destruction of Medicaid. They're talking about cutting $880 billion from Medicaid, which would destroy the program, the largest provider of long-term care in this country, a program that provides health care for seniors, for children, for people with disabilities, for tens of millions of Americans. That's what Oz's job is, to be the point person at CMS on the inside when they rip health care away from tens of millions of people. Besides that, his other job is to ensure that United Health and the corporate health insurers that delay and deny care while also ripping off the taxpayer to the tunes of tens of billions of dollars a year are put fully in charge of Medicare through a full privatization of the Medicare program. That's what's at stake today. And it is as clear as can be that this is their guy. This is the insurers, the pharmaceutical corporations. This is their guy on the inside. And he is in no way interested in the voice of physicians, of doctors. But that's why your voice is so important right now, and raising the voices of doctors across this country is so incredibly important right now.
Thank you, Alex. It's important to know what's going on in Washington, especially with so much being thrown at us on a daily basis. It's also important to remember that we have the power to shape what happens in Congress. Alex mentioned the threat of Medicaid cuts, which affects people in every single congressional district. So I'm asking everybody watching our shadow hearing to contact their legislators and tell them not to cut Medicaid. If Congress is looking for waste in the federal budget, they should target the overpayments to corporate health insurers instead. Reaching out to your legislators takes less than 1 minute. Visit pnhp.org slash save Medicaid to send an email message today. Because if there's one thing that gets legislators' attention, it's active and engaged constituents in their district. Our next speaker is Dr. Diljit Singh, who will tell us about the issues that we should be paying attention to. Dr. Singh is the current president of Physicians for a National Health Program, and she'll be sharing more about the Trump administration's plans for Medicare.
Thank you, Dr. Fagan. As a practicing gynecologic oncologist, every day I am frustrated for my patients who have Medicare Advantage and commercial insurance as I watch them struggle to get the care they need. Even the simplest test needs prior authorization that delays the life-saving cancer treatment they need. And we know delaying cancer care decreases the chance of being cured of a cancer. Dr. Oz's version of healthcare involves giving away our healthcare dollars to corporations that he's invested in and that he's been paid to sell to his viewers and online followers. This upcoming hearing is just surreal when you consider his conflicts of interest. Like Trump and the authors of Project 2025, Oz believes healthcare is a place for corporations and millionaires like him to make more money, not something that everyone in America needs to live long and healthy lives. While most Americans are hoping we fix our broken healthcare system and make good care accessible to everyone, free of copays and deductibles, Oz and the Project 2025 team wants to privatize all Medicare into Medicare Advantage plans that burden people with delays and denials of care. PNHP has shown that these corporate health insurers who promise to control costs have instead overcharged Medicare by up to $140 billion annually. Corporations like United Healthcare create these bureaucratic nightmares that seniors and healthcare professionals have to navigate to get people the care they need. With Dr. Oz at CMS, the Trump administration is planning to push millions of seniors into these corporate health plans. This would be a disaster. If Medicare were to be fully privatized, 15 million seniors would become underinsured because of reduced benefits. Healthcare workers would pour tens of millions of more hours into prior authorization paperwork, and taxpayers would lose 1.5 trillion healthcare dollars over 10 years, all to enrich these corporations. This country's healthcare insurance corporations have never saved our healthcare dollars or improved our health. What they have done is made millions for their CEOs and shareholders at the expense of our health. The Trump team likes to say we're at some fork in the road. We are at a time and a place when we need to choose patients over profits. Are we going to provide all Americans with the care we all need, free of deductibles and copays? Or will we allow profiteers to deny care and take billions of our healthcare dollars? We all deserve universal health care free of profit-driven conflicts of interest. Thank you to everyone who is tuning in, and thank you in advance for pushing your legislators to get us the healthcare system we need.
Thank you, Diljit. Seniors expect Medicare to be there for them, and they're not going to like hearing that firms like United Healthcare are delaying or denying their treatment. Unfortunately, delays and denials are par for the course when it comes to corporate health insurance. Last year, PNHP issued a groundbreaking report on the real harm this does to the American seniors, from financial hardship to physical suffering and even death, all to increase corporate profits. To read our report, visit pnhp.org/harms report. Health professionals are furious about these harms, and we're using every tool at our disposal to fight back. National Nurses United is one of the most vocal and powerful unions taking up this fight. Now we're going to hear from their president, Nancy Higgins. She's going to tell us about the only real solution to our healthcare crisis, Medicare for all.
Hello, everyone. It's great to be with friends and allies during this such a critical moment to discuss the future of healthcare in this country. My name is Nancy Higgins. I've been a nurse for over 30 years, and I am the president of the New York State Nurses Association and National Nurses United. Healthcare should be a human right, but now our healthcare system operates as a for-profit system. Its main goal is to make money for CEOs. As a nurse, I have witnessed health insurance companies deny care, delay care, and siphon federal dollars to provide subpar care. People are rightfully angry at the state of healthcare in this country. We constantly hear from our patients that they have to delay their care for fear of costs, that they are unable to afford their medication. And now we are seeing an ever-growing number of patients who are overwhelmed with medical debt. Nurses know that the way to resolve the fundamental problems in our profit-driven healthcare system is to Medicare for all. With a single-payer system, we would save this country trillions of dollars while also guaranteeing quality, therapeutic healthcare to every person living in these United States. Medicare for all would improve and extend traditional Medicare, which has been an overwhelmingly successful and popular healthcare program. It would require no out-of-pocket costs for patients for any services. It would give all patients the freedom to choose the doctors, hospitals, and other providers they wish to see. The Trump administration should nominate a CMS administrator that will prioritize increasing access to care. But Dr. Mehmet Oz does not support guaranteed health care. He would rather allow private insurance company to profit from the illness, injury, and death of patients. We urge the United States Senate to listen to the stories and concerns of millions of patients and healthcare workers across the United States. Thank you for having me today, and we look forward to working with all of you to achieve Medicare for all.
Thank you, Nancy. A single-payer national health program would be a game changer for all Americans. But Dr. Oz would stand in the way of this badly needed reform. In fact, when he ran for the Senate a few years ago, he supported Medicare Advantage for all, which would create a windfall for insurance corporations while forcing everybody else to struggle with the delays, denials, and surprise medical bills. National Nurses United understands what's at stake. So they have set up a hotline where you can call your senators and urge them to vote no on Dr. Oz. Simply call 202 998 6094 to let your senators know what you think about this nomination. Again, that's 202 998 6094. Putting Dr. Oz in charge of Medicare and Medicaid would harm all Americans, and it would exacerbate the harm that's already being done to marginalized communities. Our next speaker is Dr. Sanjeev Shiram. He's a national board member of Physicians for a National Health Program and a leader of the All Means All campaign. He's going to tell us how corporate health insurers have been especially cruel to patients of color and why we need a national health program to address these inequities.
Hi, I'm Dr. Sanjeev Sriram, a pediatrician and a member of Physicians for a National Health Program. My patients and I need your help. We cannot allow Dr. Mehmet Oz to be director for the Centers of Medicare and Medicaid Services, or CMS. Nearly all of the children and teenagers I serve at my clinic in Maryland are on Medicaid. This program and the Children's Health Insurance Program, or CHIP, are lifelines for almost 40 million children. Medicaid and CHIP are the most important sources of healthcare for Black and Latino children across America. These are the children of essential workers doing all kinds of jobs that we rely on. But these jobs do not include benefits like health insurance. My patients and I need a CMS director who values Medicaid and CHIP and wants to protect these programs from insurance company greed machines. Dr. Mehmet Oz, he puts profits before patients. He is not fit to be CMS director. Dr. Oz treats the health of patients and families like business opportunities. When faced with the choice to tell the truth about garbage health products or make mountains of money, Dr. Oz always sells out with zero regard for the health and safety of patients and families. Thousands of doctors like me do not trust Dr. Oz to be director of CMS. Now, you may be thinking, why should I care about Medicaid? That's those other people's healthcare. But as a doctor, I promise you that what happens to Medicaid affects your health too. There is not a single hospital in America that does not depend on Medicaid funding to help keep its services going. If Dr. Oz leads CMS, he is going to help the Trump regime's reckless attacks on Medicaid. Your local hospital will lose funding and will be forced to reduce staff and services. You thought you were waiting a long time in the ER now? That whole situation will get worse, and then some, if Dr. Oz gets his hands on Medicaid. Now, like many of you, I also have older family members on Medicare. I am very worried about the horrible rise of Medicare Advantage plans from these insurance companies. At Physicians for a National Health Program, we call them Medicare Disadvantage plans because they squeeze seniors into paying premiums, then deny really important care like cancer treatments and critical surgeries. Medicare Disadvantage claims they help seniors and that they improve racial equity in healthcare, but all of that is absolutely false. People of color in Medicare Disadvantage plans have worse health outcomes because of the plans denying them care all the time. We need a director of CMS who will protect Medicare and all of its patients from insurance companies' ruthless profiteering. Dr. Oz is going to sell out Medicare and seniors to the insurance companies. We must not allow him to be director of CMS. My patients deserve better. You and I deserve better. Let's demand someone better than Dr. Oz to be director of CMS.
Thank you, Sanjeev. We know how important Medicaid is to our patients, which is why we cannot allow Congress to cut hundreds of billions of dollars from that program. But as we've heard, there is waste in the federal budget in the form of overpayments to corporate health insurers. If you haven't already sent your legislator a message about cutting profiteering while preserving crucial health benefits, please visit pnhp.org save Medicaid. Sending a message takes less than 1 minute. We need to understand that Medicaid cuts will affect real people in our communities, people who need and deserve health care. Our next speaker is Reginald Brown. They're a board member of Vocal New York, which is an affiliate of Popular Democracy. They're going to tell us about the crucial role Medicaid plays in their life and in the lives of so many Americans.
Thank you, Dr. Fegan. My name is Reginald Thomas Brown. My pronouns are they and them. I'm the board chair of Vocal New York, a statewide organization whose mission is to end the AIDS epidemic, the war on drugs, which is actually a war on people who look like me, mass incarceration, and homelessness. All of our members are directly impacted by one or more of our missions. We're people who are low income, primarily Black and brown, and depend on Medicaid for our lives. In 2017, I was arrested twice to defend the Affordable Care Act. The first arrest was in front of the White House in March as one of the 24 people to represent the 24 million people who would lose their Medicare. The second arrest was in July while I was in the Senate office building sharing my story of how Medicaid paid for my life-saving medications. I was diagnosed HIV positive in 1986 and have not stopped fighting and will not stop fighting until my last breath. We beat Trump's attempted repeal of ACA, and I'm here today even after my certain death sentence in 1986 because I and others fought back. Medicaid pays for my medications. I have survived and thrived because of Medicaid, because I and others in our communities have fought back in response to the AIDS epidemic and in response to Trump's attempted repeal of ACA. One of my HIV medications that I take costs more than $3,000 per month. Medicaid pays for my medications. I have been HIV positive for 38 years and unable to transfer to HIV since 2003 because I've always had the medications necessary to keep me healthy and prevent me from transmitting HIV to others. During this time, I had had no AIDS-related illnesses because I had the medications needed to keep me healthy. Without Medicaid, my quality of life would not be what it is, or I would be dead. We stopped Trump 1, and we will stop Trump 2. If you're with me, as we're saying, call your legislators, let them know, call them, because we will do this. We will not be defeated. And as I said, I will keep fighting until I die. Thank you very much.
Thank you for sharing your story, Reginald. It's advocates like you that inspire me to take action. In this moment, it's crucial we fight back against Medicaid cuts and against the Trump administration's attack on our health care. That means organizing, organizing, organizing. Popular Democracy is doing just that, and they're hosting national calls every other Thursday to help you plug into their campaign. Their next call will take place on Thursday, March 27th, and you can register at the link in the video description below. I know we're throwing a lot of information at you today, but please note that all of these links can be found in the YouTube description for today's shadow hearing. If you registered for this event, you should also have received all of the links in an email earlier today. We're highlighting these actions because the threats to health just keep on coming. Our next speaker is Dr. Phil Verhoef. He's the immediate past president of Physicians for a National Health Program, and he's experiencing a lot of these attacks in real time. He'll tell us about just some of the moves the Trump administration has made so far and how they endanger public health.
Thank you so much, Dr. Fegan. It's really a crazy moment to be talking with you all. And I know how worried we are about the prospect of Dr. Oz becoming the head of CMS, but there's so much else that the Trump administration has actually been engaged in. And honestly, if you want a roadmap for what to expect, you need look no further than the 900-page wish list for Trump called Project 2025 that Dr. Singh mentioned earlier. This was published last year, and Trump straight up lied to us about it. He said he didn't know anything about it. He disavowed knowledge of it or its tenets. And then he promptly and aggressively put it into motion as soon as he took office. He's even elevated its authors to high-level positions. And just so you know, Project 2025 attempts to expand presidential powers, undo the checks and balances that have been the underpinning of our government. And honestly, it's calling for much of what we already see happening. It called for dismantling of the Department of Education. It calls for the use of tariffs in foreign trade. It calls for ending diversity, equity, and inclusion programs. And we've seen that Trump is just gleefully eliminating everything that he can that refers to diversity, equity, and inclusion in our federal government, right? And of course, it is this same Project 2025 that calls for all Medicare patients to be shifted to privatized Medicare Advantage programs. So I think we can expect to see more of Project 2025's proposals moving forward. We need to block that with all of our power. But let's remember, who's going to be Dr. Oz's boss when he becomes the CMS administrator? It's none other than Robert F. Kennedy Jr., who is an avowed anti-vaccine, anti-science lawyer. In the short time that he's been secretary of HHS, he's bungled the response to the largest measles outbreak in this country in decades. He's continuing to spread falsehoods about measles. He's suggested things like breast milk will provide better protection than a measles vaccine, or maybe that it would be better for everybody to get measles, or that the measles vaccine actually kills people. It's insane that a liar and a grifter is literally overseeing these agencies like the FDA or the CDC or the NIH. Oh, speaking of the NIH, have you seen what the Trump administration has done to them? He has massively cut federal spending on research. This is gutting the ability of our universities to support NIH-funded researchers. He's eliminating funding for research into vaccines. He's eliminating funding for research focused on health equity. He has politicized research. And let's not even get started with what's happening at the CDC, right? Trump has fired hundreds of public health workers, putting our country at far greater risk for public health catastrophes, like a measles outbreak, right? So, we have a CDC that is gutted now. And let's not forget immigrants, right? So, when we think about the people who come here without documentation, they used to be safe to seek health care in hospitals, but not anymore. Now they could be subject to raids in hospitals, a place that was previously a safe place. And so that puts actually more of us at risk as well. So he's literally stripping First Amendment rights, both from people who are lawfully here as well as those who are seeking asylum with us. And so we know that Dr. Oz's confirmation represents a true threat to the Medicare and Medicaid programs, but we also know that it's part of a much bigger concerted effort to destabilize and destroy our federal government. So please, I implore you, pay attention and never stop resisting. Thanks.
Thank you, Phil. If you've been affected by any of these awful policies, I encourage you to share your story. The legislative outreach form we put together includes a letter about rejecting Medicaid cuts, but you can edit the text and include your own personal experience. Members of Congress need to know that their constituents are impacted by these policies. We're not talking about the numbers or statistics here, but people's lives. Please visit pnhp.org/Save Medicaid and urge your legislators to do the right thing. These fights may feel daunting, but activists are making a real impact, even against long odds. Our next speaker is Julie Schwartzberg. She's one of the founders of Cross Union Retirees Organizing Committee in New York City. She's going to tell us about the fight to save Medicare benefits for municipal retirees, a fight that's been waged in the courts as well as in the streets.
Good morning. Thank you so much for having me. It's upsetting to hear all of this and what's happened to us retirees. I am here to testify that the Dr. Oz Medicare Advantage Plan has already begun with public sector retirees all over the country. In New York City, 250,000 of us are being pushed into a Medicare we call disadvantage plan. And we have been fighting against it for 3 years. And we are enraged and we are fighting back. And I'd like to share with you some of the ways that we are winning. One of the most valuable movements is for the New York Health Act, because under this new administration, we are hoping in New York State to get single payer, and we are fighting for it like crazy. But what we've learned is that we have to work together. It's not only us retirees who on Medicare disadvantage. We have to work with people who are being denied or threatened to deny Medicaid, food assistance, and other vital programs. And what I would like to do is anyone is in New York City who would like to come on our action on Saturday is to stop all the cuts. There is going to be a huge demonstration with a healthcare contingent in New York City. We are not giving up. Please join us.
Thank you, Julie. Seeing those crowds in New York tells me that seniors don't want to be stuck with Aetna or Cigna or United Healthcare. They want the public Medicare benefits that they paid into their entire working lives. And I'm sure they'll be showing up in force for tomorrow's action as well. We need our elected officials to understand that Americans don't want them to cut Medicaid in order to fund tax cuts for the rich. We want them to cut overpayments to insurance corporations and to reinvest that money in traditional Medicare. If you agree, please visit pnhp.org/save Medicaid and tell Congress to get their priorities straight. It's important that we connect with each other in order to win these fights. Our next speaker is Dr. Zach Pellis. He's an internal medicine resident in Chicago who works closely with patients, families, and colleagues, despite the ever-present threat of corporate greed. He'll tell us why firms like United Healthcare should never be trusted to administer Medicare benefits.
Good morning. My name is Zach Pellis. I'm an internal medicine resident in Chicago, and I appreciate the chance to share with you my perspective on why Dr. Oz should not be confirmed to lead CMS. The role of CMS administrator hits very close to home for me as a medical resident because it would give Dr. Oz full control over the funding of all medical training programs in the country. And I don't know any of us who would feel comfortable with our paycheck and our education in the hands of our country's most successful snake oil salesman. But the problem is far broader than that. The role of CMS administrator would give Dr. Oz the chance to make good on a promise that he made when he ran for the Senate and an explicit goal outlined in Project 2025, which is the full privatization of the U.S. healthcare system. The reason this is such a risk is because Dr. Oz has been a long fan of Medicare Advantage. Dr. Oz believes that Medicare Advantage should be the sole option for insurance in our country, and the only way that's possible is with the eradication of traditional Medicare and Medicaid. This would remove coverage from millions of Americans and force them into a private option. It's already well documented that Medicare Advantage, in right now, present day, is overcharging the American taxpayer by billions of dollars per year. On the individual level, when I see a Medicare Advantage plan in a patient chart, I expect one thing: limitations. I expect there to be limits on the kind of care I can provide. I expect there to be limits on how that patient can follow up. When I've made a decision, I expect there to be prior authorizations where I have to try to justify that decision to someone who's never met this patient. This happens frequently. One example in particular I can think of was a patient I took care of in the hospital who had overcome a dramatic and life-saving abdominal surgery, but afterwards had all kinds of problems that we had to manage for her over days and weeks. This included an infection that we had to treat, an oxygen requirement we had to get her through. We put her through physical therapy. We referred her to a specialist. That specialist had referred her and recommended that she go to acute rehab, and this was denied by her Medicare Advantage private insurance company. Once they denied it, we then had to go through a prior authorization. We had to grovel and beg these people who have never met this patient to allow them to pay for the care that we think this patient needs. And often, as was the case with this patient, you go through that whole process just for them to continue to deny that care. This problem already exists. It's already a fatal flaw in our country's healthcare system, and it will only get worse under Dr. Oz's leadership. Dr. Oz and private insurance companies are one and the same, out to make a buck and uninterested in caring for our country's seniors. I appreciate your time, and I hope you'll join me in resisting any and all effort to put profits over patients.
Thank you, Zach. We know by now the corporate health insurers will always put profits first and the well-being of patients a distant second. That's why we need to crack down on their harmful behavior. Stop rewarding them with billions of dollars in overpayments and invest in traditional Medicare in order to give seniors who are stuck in the Advantage plans a real choice. If you'd like to see Congress invest in vision, dental, and hearing benefits and fully fund Medicare prescription drug benefit and implement a out-of-pocket maximum, then contact your legislators today. Use our simple web form to have your say, and please share the link with everybody you know who cares about the future of Medicare. Dr. Pellis told us about his experience as a resident, but it's important to know that there are unions fighting for him, his colleagues, and his patients. Our next speaker is Taylor Walker. She's the president of the Committee of Interns and Residents, which has been organizing House staff across the country. She'll tell us how the impact of corporate medicine is having on the impact that corporate medicine is having on teaching hospitals and residency programs and the patients they serve.
Thank you so much, Dr. Fagan. Good morning, everybody. As Nancy said, it's great to be here alongside friends in this fight. My name is Dr. Taylor Walker. I'm a family medicine physician and an abortion provider trained at Cambridge Health Alliance in Boston, Massachusetts. I'm also the national president of the Committee of Interns and Residents, CIR-SEIU, which is the nation's largest physician union, who represents residents and fellows like Dr. Pellis, who you just heard from. So I wanted to share a little bit of my personal story. I grew up in Memphis, Tennessee. That is a state with some of the worst health outcomes in the country. For 7.5 years, I watched my mom battle ALS. Medicare and Medicaid were her lifelines. They provided the care, the equipment, the medications that she needed as her body failed. Her hospice nurses, Gladys and Bird, became part of our family. I lovingly say that I was raised by mom's hospice nurses. They taught me how to pry the perfect over easy egg and how to do the bedside care that I still use today. Mom's Medicare and Medicaid coverage brought Gladys and Bird into our lives, and without them, my family would have been financially devastated on top of losing my mom. Nearly 10 years later, after she passed, I started medical school in Tennessee. Tennessee's decision not to expand Medicaid left me in the coverage gap. I was 26 years old. I was unable to work while studying, but I was also ineligible for assistance or subsidies. So my Medicaid insurance coverage would have cost $800 a month with a $5,000 deductible, which is almost $12,000 out of pocket before insurance covered anything at all. Because of that, I went without health insurance for 5 years while pursuing 2 graduate degrees and preparing to care for our country's most vulnerable population. I know firsthand what it means to make healthcare decisions based on cost rather than on need. As president of CIR-SEIU, I represent over 37,000, not quite 70 yet, residents and fellows nationwide. We are the largest physician union in the country, and we're also the fastest growing healthcare union. We have doubled in size after the start of the COVID-19 pandemic, which laid bare the deep cracks in our healthcare system. We are now in a fight against the corporatization of healthcare, where profits come before patients and workers. CIR members see the union as an avenue for change, fighting to protect Medicaid and the 85 million Americans who rely on it for the dangerous policies pushed by RFK Jr., Dr. Oz, and the Trump administration. You just heard Dr. Pellis say that resident salaries, teaching costs, and training infrastructure all flow through CMS, a fact that few people realize. Budget cuts or privatization threaten not just the current patient care, but also our ability to train the next generation of doctors, deepening the physician shortage as our population ages. Dr. Mehmet Oz's nomination to lead CMS is an existential threat to both Medicare and Medicaid and physician training. His push for Medicare privatization through so-called Medicare Advantage, which you've heard all of us call Medicare Disadvantage, should alarm everyone here. For resident physicians, privatization destabilizes training programs. When profits drive healthcare, teaching hospitals, which care for our most complex patients and operate on very tight margins, become extremely vulnerable. We have already seen hospital closures and residency cuts when private equity enters healthcare. The 37,000 residents and fellows that I represent are deeply concerned that Dr. Oz would accelerate the corporate takeover of Medicare. These young physicians entered medicine to heal, not to fight through insurance barriers designed to maximize denials. Our patients cannot afford to have their health care dictated by shareholders. The most vulnerable should not bear the burden of restrictive networks and coverage denials while corporations post record profits. I urge the Senate Finance Committee to reject Dr. Oz's nomination. The health of millions of Americans and the future of physician training hangs in the balance. Thank you so much.
Thank you, Taylor. It's going to take all of us working together to fight back against the threat of privatization. We have a tall task ahead, but we also have the power to get it done if we stand together. Our next speaker is Dr. Tutu Musa Diallo, who understands what's at stake in this fight. Dr. Tutu is a leader with the Northwest Bronx Community and Clergy Coalition, which is an affiliate of the People's Action. She is going to explain why we should stop rewarding corporate health insurers for skimping on care and restricting people's choice of medical providers.
Good morning. My name is Dr. Tutu Musa Diallo, and I am a leader with Northwest Bronx Community Clergy Coalition and Health Justice Steering Committee. If we are all born free and equal in dignity and right, why does health inequality continue to exist in America? I'm here today to describe how corporate healthcare insurance and insurance company failed us. The Center for Medicare and Medicaid Services, CMS, provide health coverage to over 160 million people, and I am one of them. So who can say that all these three goals are met? How can Dr. Mehmet Oz, a former TV personality, can incentivize a system that is already broken, and where corporate health insurance companies prescribe policy and outcome? And why is this pervasive and differential treatment in America healthcare system continues to wreak havoc, deny access to care, access to quality services, and access to treatment? How can this broken system be incentivized when there is no health equity? Why do some zip codes get better health insurance and treatment than others? I was told once that people in Queens, there are specific zip codes that get better health insurance than people in the Bronx. Why can't we move to that zip code in Queens? I've been here over 40 years and I have only struggled and suffered because our healthcare system has been a huge part of my struggle. I work 3 and 4 jobs, and right now I am left with a physical disability. Most recently, in 2022, I fell and landed hard on my left ankle and broke the bone, and which ended up with a 1 centimeter wide. As a result, my ankle injury, I ended up forced to go to a clinic where I didn't get the care that I deserve. So I'm asking you all, with all we have in this place, why can't we have universal health care? If we have right and equal access to health care, why can't we be treated the same? So I'm asking all of you to really advocate for universal health care in the United States. Thank you.
Thank you for sharing your story, Dr. Tutu. Nobody should have to suffer at the hands of profit-hungry insurance corporations. Unfortunately, stories like yours are all too common, and they'll become even more common if Dr. Oz and the Trump administration get their way. One way to fight back is by talking to people who stand to be hurt. By these corporate giveaways. You can do just that by signing up for a virtual phone bank hosted by People's Action. Their next event will be held on Thursday, March 20th in the evening, and will target voters in key congressional districts. You can join these phone banks from anywhere. Please sign up today. We're getting ready to wrap up our shadow hearing, but before we do, I want to go back to Alex Lawson from Social Security Works, who's standing outside the hearing room along with one of our board members in the D.C. area, Dr. Alankrita Olson. Alex, what can you tell us?
The hearing is just about to start here. The stakes could not be higher. What we know about Oz is that his job is to be the man on the inside for the wholesale destruction of Medicaid, $880 billion cut out of Medicaid, the wholesale privatization of Medicare, which leads to delays, denials, harm, and death. Those are the stakes that we're talking about today, and it's why it's so important that the voices of physicians, of doctors, of med students are heard. And to speak to that, it's my honor to hand the microphone over to Dr. Olson.
Hello, I'm Dr. Olson, and I'm outside the Senate Finance Committee hearing for Dr. Oz. As we saw in our shadow hearing, Dr. Oz is a big supporter of corporate health insurance. So it's no surprise that Trump picked him to lead CMS so that he can cut Medicaid, privatize Medicare, and make it difficult for our most vulnerable to receive care. As a doctor, I will not stand for this, and I'm not alone. Thousands of doctors, especially young physicians, residents, and fellows, and more importantly, medical students across the country oppose this nomination and demand our senators vote against him. Instead, they should listen to the majority of physicians and medical students that support a single-payer Medicare for All system. As a medical student, I joined Students for a National Health Program and grew as a leader in championing for a better healthcare system, Medicare for All. And SNAP continues to be a leader in the Medicare for All movement, working to educate the public, bring debt relief to thousands, as well as demanding and pushing medical institutions like the AMA to stand up against profiteering. PNHP and SNAP, along with our coalition partners, know that a better healthcare system is possible. If we redirect the money that we waste with these private insurance middlemen, we can cover everybody and ensure everyone gets good care. Patients will not go bankrupt from seeking care and will be able to choose their doctors. Doctors can finally spend time with their patients again instead of having to deal with insurance and fight denials. And we can finally prioritize public health and preventive care to allow all Americans to lead healthier lives. We know this is possible, but it'll take all of us. So I want everyone watching right now to join us in our fight for Medicare for All, and we can definitely win it with all of us together.
Okay. Thank you, Alex and Krita. It is clear to me that Dr. Oz and the Trump administration are planning to gut public health care in this country. They've already called for huge cuts to Medicaid, and they're planning to hand Medicare over to the corporations like United Healthcare. Also, let's not forget that President Trump paved the way for the Roe v. Wade to be overturned during his first term, and his most zealous anti-abortion supporters will be expecting even more radical restrictions on reproductive health care. Despite what Dr. Oz may say in his confirmation hearing, I want to make one thing clear. Health professionals do not want this. We don't want Medicaid cuts. We don't want huge giveaways to United, and we don't want corporate middlemen dictating what kind of care our patients can receive. What we do want is a single-payer national health program that provides universal coverage, comprehensive benefits, and zero out-of-pocket costs. And we can have that. We already spend enough money on health care in the United States to have the very best health system in the world. We just are not getting our money's worth. I hope you'll join us by taking action today. Reach out to your legislators. Tell them to vote no on Dr. Oz. Tell them to reject Medicaid cuts. Sign up for a phone bank. Join the emerging national campaign to fight back and connect with our movement to win improved Medicare for All, a healthcare system that brings everybody in and leaves nobody out. Thank you for joining us today.